do it. Let's do it. Come on, girl. Come on. Welcome to the kickoff MS awareness event. We are going to have an adaptive yoga conversation with Dr. Gretchen and a demonstration with Yvonne. Before we begin, I'm Mindy Eisenberg. For those of you who don't know me, I'm the director of Yoga Moves MS, which is a nonprofit that provides daily adaptive yoga for individuals impacted with MS. And these classes are complimentary. Before I begin our demo with Yvonne, I want to thank our sponsor. This event is supported by More to MS, an educational resource for MS patients and their care partners. More to MS empowers people to live well with MS by providing holistic tips and resources around living a healthy lifestyle. Through the campaign, Janssen seeks to champion diverse, real-life experiences with MS warriors and their care partners and bring valuable resources to the community to help them live well. Visit moretMS.com, where you can find information about MS tools and resources to help have open, honest discussions with your healthcare team about the right treatment for you and a customized approach to managing MS symptoms. So we've got a really jam-packed agenda for you today. As I said, we're going to do an adaptive yoga demo and conversation. I want to introduce two very special people. Many of you know Dr. Gretchen, physical therapist extraordinaire, but just in case you don't, she has developed a PT for MS program over the years. After she graduated from her physical therapy program, she worked with very notable top neurologists in her community, and at the same time started to develop this well-respected physical therapy program called the MSing Link, where she uses the concept of neuroplasticity. She helps her patients reduce fatigue, get stronger, improve balance, and walk better. Many of you have seen her on her YouTube channel and in social media, and maybe even heard her podcast. So this is Yvonne.
Hi, everyone.
Yoga Moves MS student of over 12 years. Yvonne has agreed to be our demo for today. You're going to see. Now, keep in mind that Yvonne has been doing yoga for over 12 years, so she's become my teacher.
No.
Oh, yes. Thank you so much for agreeing to do this today so that everyone can realize how adaptive yoga is for anybody.
Yes.
And Dr. Gretchen is going to discuss with us how the poses benefit you and also how yoga fits into your wellness routine in different exercise. So we're going to get on with the agenda here. We will have a very generous time for question and answers after our demo. So you can start to write your questions in the chat and maybe let people know where you're from. We have so many people, I'm not sure what the total is now, but over 400 registered. And we are so happy that all of you are joining from all over. So if you'd like to put in the chat where you're from and as we start our demo and conversation, you might think of questions, write them in there. Then we also, after the questions are over, you're going to want to stay around because we're going to have a giveaway and your chance to win. Dr. Gretchen, do you want to say what's on the prize list?
Yeah, so I'm going to be giving away 2 complimentary months to 2 individual people to my online MS wellness program, the MSing Link. If you guys don't know what that is, it is a wellness platform filled with tons of recordings of me demonstrating my favorite MS-specific exercises to help you improve function. Things like walking in your home, stair climbing, transfers. We also have expert guest speakers every month that you can join us live. Mindy was our guest speaker 1 or 2 times, which was amazing. We have yoga, we have research updates. So one place you can come for all of your MS specific physical therapy and exercise needs. So we're giving away 2 of those to 2 individual people.
Awesome. Thank you so much for your generosity. And we will be giving away an adaptive yoga book, an adaptive yoga cards, and a leg lifter, which Yvonne will demo how this can be used to stretch as well as to leg lift. So having said that, stick around, stick around. All right, we're gonna begin our demo.
All right.
You ready?
Yes, I am ready.
Okay, you ready, Dr. Gretchen?
I am ready.
All right, we're gonna start with mountain pose because mountain pose is the pose where all poses really emanate from if they're a standing pose and many of the seated poses. So Yvonne is actually sitting on a blanket here. And the reason she's sitting on a blanket is because Yvonne's got really beautiful long legs. And so it helps her to keep her hips and her knees fairly level, her lower back. Now, another trick we use in yoga sometimes is we stick, I don't know, many of you might have something like this, swim noodles, and we will put it behind somebody's back, which you can do in a chair or a wheelchair. And how does that feel, Yvonne?
That is very comfortable.
Why don't you lean a little bit forward, we'll get it down a little bit more like that.
That's very comfortable.
So you can see that anybody can do yoga. This is mountain pose. And we might have our arms down by our side with the palms facing forward. That helps to bring the shoulder blades on the back. So you guys can try some of these poses as we do them today. There will be a recording that you can watch afterwards to try them at your own leisure as well. Dr. Gretchen, would you say anything about this pose in mountain pose or how it relates to posture? What are key points you look for when it comes to posture in a pose like mountain pose, either seated or standing?
Yeah, mountain pose is one of my favorite exercises, either seated or standing. And a lot of the times I get some weird looks when I say that it's my favorite exercise, because sometimes it doesn't really feel like an exercise. We're so used to exercise, meaning walking, the Stairmaster, jumping jacks, lunges, that simply staying in this position isn't what we're used to when we think of exercise. But so many movements that we do should stem from a seated or standing posture that looks exactly like this. And sitting up tall or standing up tall, just as Yvonne and Mindy are right now, is activating their core muscles in their belly, the core muscles in their back, their shoulder muscles and upper back muscles. And when all those muscles are engaged, so many movements are easier. Walking is easier, moving your arms is easier, reducing low back pain. So yes, this is one of my favorite exercises. And I agree with what Mindy said. It can either be supported, like Yvonne has the noodles behind her back right now, or unsupported. Supported is the easier option. So if it feels too challenging to not have that support on your back, use the support at first, but work your way towards not using support.
Oh, we're taking it away.
Okay.
Wait. So a few concepts we use in yoga is this idea of rooting to rise. So as Dr. Gretchen said about activating your muscles, one of the things you can do is push your feet down into the earth or the ground, however you think of it. We press our feet down and that starts to activate our legs. And if you're standing for balance, you may have your feet about hip distance apart, or maybe you want your feet slightly wider. We generally want to keep the knees, have a little bit of bounce through them so they're not locking back. Looking for weight in towards the center of your arches or center of your feet. We try to bring the rib cage over the pelvis and feel the shoulder blades on the back. So when you're pushing down through your feet, you can feel this rebound up through your spine. You can see how Yvonne sits so beautifully. Now that's a lot that I just kind of spit out. Yoga teachers tend to do that. So you might only focus on one thing that resonates with you, like shoulders over rib cage or shoulders over pelvis. Anything you would add to that?
I think that's great. And I think that your main focus might just be sitting up tall or standing up tall, and knowing that as long as you're not tipping over, every muscle in your body is working equally. Otherwise, you would be tipping forward or backwards or to the right or to the left. So simply by just staying in this nice tall position, seated or standing, all the right muscles are working equally, which is important.
And sometimes we start a class by doing things like tilting forward and back just a little bit, or rocking the weight forward on the feet, forward and back, or the pelvis moves a little forward and back, so we can find that center point. And you start to notice where your belly does start to tone if you lean too far back. So it's a nice way to engage the belly. All right, from mountain pose. Very often we'll start in yoga with some joint freeing. So you guys can all circle your ankle, or your wrists around one way and then the other. And then we would move on. Now keep in mind, I'm kind of keeping this going so we can get through as many poses as possible in our time together in a way that you can feel. But just to give an idea, we might do some ankle circles as well. Yvonne, can you show how we would do the ankle circles? Yes, right, so kind of like you're painting with your toes.
Mm-hmm. Yes, I am.
And then we might do some flexing with the toes coming towards you and pointing away. Now, Yvonne could, or someone might feel like they want to lift their leg up, so they might put their hands underneath their thigh, or use something like a yoga strap or a scarf or a belt to lift their leg up. Sometimes when we're doing the pointing and flexing, we get comments about spasticity. People feel that there's some rigidity in the ankle, and so it's challenging to point and flex. Dr. Gretchen, would you suggest anything to help with that?
Yeah, so I was just thinking as you were saying this, this is another one of my favorites. I feel like I have like maybe 4 or 5 favorite exercises. And this is another one. If you're in the MSing Link, you know that what I call this is ankle dorsiflexion. And that's the part where you're lifting your toes up towards you. This is a necessary exercise for anyone that has foot drop, drop foot, foot slap, foot drag, whatever word you want to use to call that motion of your foot dropping. So that exercise of lifting your ankle up towards you is a perfect one to strengthen that specific muscle group you need to reduce that foot drop. However, I love the ankle rolling as well. I like to call it the ankle alphabet, where you're drawing the alphabet with your ankle or with your big toe. And this is really great too, because if you have reduced mobility in your ankle, that is often correlated to reduced balance. So when we're balancing, our ankles should wobble a little bit. That's normal. It's called the ankle strategy. But if you don't have the mobility in your ankle to wobble, you're more likely to just step to the side or to fall over because your ankle isn't allowing for your body to come back to a centered balanced state. So ankle dorsiflexion is what I call it, that ankle lifting, really helpful for a foot drop, and the ankle alphabet or ankle rolling, really, really helpful for balance.
So sometimes we use a strap to help pull the foot or the toes towards. We press down through the heel, and then we can use the strap to pull the toes towards you. And that can be helpful if it's feeling kind of stiff. So Yvonne is showing that. How's that feel?
That feels great. My left side is a little challenging, but the strap helps so much
to pull it towards you.
Yeah, to pull it towards me and to exercise it to make it stronger.
And we might play with spreading the toes at the same time. Now, a lot of people stare at their toes. Don't do that. Don't do that. because you're sending a message, right, Dr. Gretchen, the neuroplasticity, you're sending a message whether those toes come towards you or they don't.
And you're watching.
Yep, exactly. We'll take that out. Sometimes students will bring their foot up over their thigh and then use their hand to help out the circles and the point and the flexing as well. All right, so now we're going to go on the cat and cow pose. So cat and cow pose seated.
Okay.
All right, you ready?
Yes.
I'm going to show it to the side while you show it forward.
All right.
All right, let's do cat pose. So we take our into our chest and we lean back. And the breath is really important in yoga. So usually we take a nice exhale on the cat pose. Now let's show cow pose. So we inhale and we lift our heart. Something else?
They're asking to see your feet.
What?
They can't see the feet, so I'm just pulling it back a little bit.
How did that happen? Oh, when we changed the camera. All right, now we're in cow pose. So we're feeling the shoulder blades on the back and the sit bones going back. So someone asked about feet. So in this pose, we're pushing down. Let's go back into cat. We round the spine. Now you're feeling your shoulder blades move apart. And then we inhale and we lift upwards. So this is really nice to help the movement of the spine. It helps make space in the spine. Would you like to add anything to that, Dr. Gretchen?
Yeah, I think so often when someone is working on improving their posture or their mobility, we tend to focus a lot on strengthening, and cat-cow does include some strengthening, but more importantly, it includes that mobility of our spine, which if we don't have the mobility to be able to get to this elongated position, it's going to be much harder to have the strength there to keep yourself in a good posture. So I love cat-cow for the mobility in our spine. So many things we do throughout the day require us to have a flexion and extension position. But if we're used to slouching, that also is going to tighten the muscles in the front of our shoulders and round them forward. And if we're more rounded, that's going to make it harder to come back. So the combination of the cat and the cow works your spine as well as your shoulder blades, as Mindy said, and your shoulders as a whole. And that mobility can help immensely with really any function, but especially posture while sitting, while standing, while walking around. Yeah,
Yes.
that's great.
This pose, in all yoga poses, really the primary fundamental building block is the breath. So we actually can build a little bit of strength when we're doing, especially cat pose. Cat pose comes in very handy in a whole bunch of different ways throughout our day and practice. So try this. Lean back. So this is an intentional leaning back. This is not slumping, right? When we're doing this pose and we're intentionally doing it, and then pull your belly back, you lean back on your sitting bones, you feel your belly pull into your spine. And then we lift up, and that's usually the inhale. Okay, we will move on to our next pose, which is side bend. And Yvonne, would you like to show a side bend? Would you like to show it seated or standing? Which one would you like?
Seated, I would prefer.
Okay, go for it.
All right.
So we're gonna lift up tall, like we're in mountain pose. And then we might lift our left arm towards the sky. So you might, some people may be a little bit tight or have something going on in their shoulder. So they might keep the elbow bent. Some people do a side bend with their arm down. Let's show the side bend towards the right. You can keep your arm up. There you go. And I'm going to show it with the arm down. And then here is side bending. So take a breath in and a breath out.
Doing exercise.
Inhale, we're gonna push down through our feet and rise back up and lower the arm down. How did that feel, Yvonne?
That felt fine
Where did you feel a stretch?
in my shoulder.
You did feel a little bit of stretch in your shoulder. Was it painful?
I know it wasn't painful, but like I said, my left side is a little challenging and it got a little tired and I was able to put it on my shoulder or my waist to get the same effect of that.
Perfect. So that's how why we call it adaptive yoga. Yvonne's been doing it for a while. When we're teaching the class, we offer different options so that you do the option that's right for you. And I want to add in, what is our motto? No pain,
No gain.
all gain.
All gain.
No pain, all gain.
All gain.
All gain. No pain's allowed in yoga. Do you allow pain in PT?
Never. Nope.
No
No
pain
pain.
allowed. No suffering.
Nice.
All right, let's do the other side. And you guys can be doing this with us. Now, some people use both arms and they use their left hand to perhaps lift the right arm up. So we call these co-workers. And then you, like I said, you can be seated or standing. We're gonna push down through our feet and push down through our hips, lift our belly in and up. So we're gaining length. Then we take our side bend over towards the left. And there's all different combinations of the arms. And then we'll push down and rise up. So one of the benefits from a yoga perspective, you can lower your arm down. So I should mention too, sometimes the teachers get caught up talking, and if you notice that you have fatigue in your body, you're taking it's your body, you're looking inside in yoga. We kind of call it a work in rather than a workout. With the side bend, it really helps our breathing because we often get tight in these muscles in between our ribs and along the side of the body. Anything you would add, Dr. Gretchen?
Yeah, so I really like side bend for function. I'm all about function. Every exercise that I give is to help with a specific movement throughout the day. And side bending can really help with things like picking up groceries or picking up laundry. Anytime you have to do a side bend, even if it's a side but slightly forward, like more at an angle, that can be really helpful to stretch and strengthen those abdominal and core muscles that can help you reach down towards the floor or down towards a chair or a table. So very functional exercise to do for that type of movement.
I would, yeah, and it can even help with balance because we're leaning to one side, so we have to keep ourselves from falling over.
Yes.
So
Yep.
I think the core there too. So let's do a little seated sun salute together, or you can stand if you prefer. And we're going to take our arms out to the side, the stuff up to the side, and take our arms up overhead. And then draw your palms into your heart. Yoga is very much about a heart-based practice. We open up our heart in yoga. Exhale, lower your arms down by your side. So we call it a mind, body, spirit practice. Arms out to the side, up towards the sky, exhaling, pulling your palms down to heart center. Next pose is Yvonne's favorite.
Say one of them.
But no, it's actually not necessarily your favorite, but we do it anyway, right?
Okay, I'll do it.
All right, she's so ready and willing. We're gonna do chair pose. And I think you do versions of chair pose too, don't you, Dr. Gretchen? I think maybe you call it something different.
Yes, yep.
We're gonna put a block in between Yvonne's thighs. She's gonna place the block, which can be very helpful. And by the way, you don't have to have yoga props. You can use substitutions. So if you don't have a yoga prop, such as a block, you know what became popular during COVID is toilet paper rolls.
You get what you can get.
Yeah, sometimes you have those small exercise balls that you can do too, but it helps to activate the inner thighs and the core.
Okay.
So we're gonna play with rising from the seat, from chair pose. And so now you should know that we can use a chair in front of Yvonne, so she knows it's there for balance. And she might have her walker. You can also use a walker if you don't have a second chair. And then she may or may not rise up into chair pose. So what would you like to show, Yvonne?
I can use the chair on my cane.
Okay, I'm gonna hold the chair so it stays stable. Now, normally you wanna make sure you have a chair on a surface that is not going to move.
Okay.
All right.
One. I'm gonna do it on 3.
Okay, she's going on 3. Awesome, awesome. This is the idea. Awesome, Yvonne. Everybody cheer Yvonne on, even though you're on mute. Yes, yes. So now she's in mountain pose, and now she's gonna bend her knees, come back to chair without lowering down quite yet. Relax, relax. Are you breathing, Yvonne?
Yes, ma'am.
Yes, yes, yes. That's the most important part. Now she's slowly gonna lower down. If she wants her arms up overhead, she might take them. We're actually gonna show you one of Yvonne's favorite things to do. Yeah,
Okay.
you ready? Where'd it go? She likes to use her cane. We came up with this during class. Yvonne's been with us for 12 years. So many of the ideas that we came up with through adaptive yoga are through the creativity of our students. It is a creative process. So Yvonne, you show them your favorite way to get into chair pose. She likes to use the cane. Awesome! Are you breathing?
Yes.
Exhale, slowly lower back down. All right. Was that chair in the way?
No, it wasn't.
Did you guys all see that? Anything you want to add about this pose, Dr. Gretchen? We know it helps the thighs. What would you like to say about it?
Yeah. Oh my gosh, this is a great exercise. For starters, if you think about what Yvonne was first doing before she even attempted to stand up, it was the shifting of your weight back and forward and back and forward. And if you think about it, we do that motion anytime we want to stand up, whether it's from the toilet, a couch, a chair like Yvonne is sitting on right now, if you're getting out of your car. So it's a very functional movement to practice that leaning back and coming forward. It requires a lot of core strength and shifting of your body weight. And then when Yvonne went to stand up, you are activating your quads, your calves, your ankles, your glutes, almost every muscle in your leg, which again, you need in order to stand up with good strength and sit down without plopping down. I know a lot of my clients have a tendency to plop because they're not using their muscles in the right way. So great exercise for core strength, weight shifting, and leg strength.
Thank you so much. Now, you don't have to do it with the block, but we find it's very helpful. Sometimes we do it without the block, then we do it with the block, and then we take the block away. We also use it because it helps keep the knees in alignment over the middle toes. Because very often when we rise, the knees sometimes buckle in. So it can be very helpful in that way. And I should mention, as Dr. Gretchen said, we do this pose every day when we're getting up and sitting down at the dining table, and even when we go potty. So we call it potty pose very often as well. And you can play with it from the seat, rising, and then also slowly lowering down instead of plopping, as Dr. Gretchen said. All right, let's go on to a twist. I hope you guys are doing some of these with us. We're gonna do a seated twist. So we sit up tall, right back where we are in mountain pose. And we're gonna take the left hand outside the right thigh. And then the right hand can come behind you. Now it can touch the seat of the chair or perhaps the back of the chair. And then we slowly lift up through the spine as we take an inhale. And then exhale, we might open a little bit more. Now I like to press my hand into the thigh and then the thigh into the hand. It gives a little bit of leverage. And we're always watching the neck. We don't want to turn the neck too fast or give it any bit of torquing. I always think of the neck as vulnerable. And so we want to listen to our body and feel as we turn. Neck is last. And then you might take your gaze over your shoulder. Maybe, maybe not. We always say maybe because the options are on the table for you and you choose what's right in your body. What do you think the benefits are of, I should say, what do you think? What do you know are the benefits to a twist, Dr. Gretchen? We'll come
there's two main ones. So first and foremost, I love the twist. I think I saw in the chat, Adam, is that who it was? Yeah, Adam says, you know, I love the twist. Twist, at least for me, just feels so good because very rarely do we twist throughout the day, and our spine is meant to twist. So it can get very, very rigid. So by adding a twist, it just feels like a great stretch. You're loosening things up. And keep in mind, the more mobility you have in your spine with the twisting, with the cat and the cow, with the side bending, the more mobility, the less pain you'll have throughout your whole back, but especially your low back, and the easier movements will be. So that's one reason I love the twist, is just getting that mobility that you wouldn't otherwise get throughout your day. But the second thing, if you paid attention, Mindy said that she likes to push her hand on the outside of your knee. And if you push and pull, like if your knee pushes out against your hand and the hand is pushing towards the knee, you are activating the outer thigh muscles. Yep, just as they're demonstrating. So they're activating the outer thigh muscles, which can help prevent your knees from collapsing inward. So this really is a 2-in-1 exercise for your thighs and your spine. And I saw someone in the chat said, it's good for digestion, absolutely. Helps decrease tightness, spasticity. Yeah, it's, at least for me, the spine feels like such a central part of our body that if we can keep it fluid, everything else falls into place more nicely. So great. This is one of my favorites. If you've ever done one of my classes, I always will do this throughout the class because it just loosens things up.
I always feel it really across the collarbone, this opening. It's very much
Yeah.
The upper body as well. It's kind of like you can get so much in with this pose.
Yeah.
Go right ahead. I think every pose is your favorite, by the way.
I know. Well, one thing that I like to do with the twist, if you are also trying to work on posture, you can open up your front hand out this way. And then you're getting a stretch in this pec muscle as well. Because sometimes if you're twisting this way, you can have a tendency to round your shoulder. So opening it prevents that from happening.
Yeah, that's a nice way to say it. And also, if you grab the back of the chair with your hand, then you can open up that back shoulder too and kind of use it as a lever.
All right, that feels really good.
Yvonne will tell you, she only speaks the truth. All right.
It feels good.
We're going to move on to leg stretch, and we're going to actually use the leg lifter for our leg stretch. This is one of my favorites when people say they have a lot of leg spasticity. So here you go, Yvonne. We're going to show the stretch. I'm going to use a yoga. Actually, I'm going to use neither. I'm going to place my hands underneath the thigh. Yvonne's going to place the loop of the leg lifter around her foot, which she also could use for the flexing, by the way. And then you can keep your leg down, or you can lift it up and push the heel away. And we stay tall through the spine at the same time. We still have mountain pose going in this one. We might play with spreading our toes. We might even play with pointing and flexing here. The leg is heavy. Keep that in mind. These are pretty heavy bones. And so you're doing some weightlifting at the same time.
We're getting stronger.
So where do you feel the stretch, Yvonne?
I feel it in the back of my legs.
So you feel it in the back of your thigh?
Mm-hmm. Back of my thigh, I feel it.
Now another option is to place the chair seat underneath, or if you have like an ottoman or a sofa near you, you might put, I love yoga with 2 chairs. It's a really nice way. It's another prop. The chair is a prop in yoga. So that makes it a little bit easier to get it up there, but then how does it feel doing the stretch?
I still feel it in the back of my thigh and also in the back of
Your calf?
my calf as well. I feel it all the way in the back.
Anything you would add, Dr. Gretchen? This is one of my favorite for spasticity and lengthening through the back of the leg.
I agree. And I think it's important to know that when you do have spasticity or tightness in your hamstrings, that will cause your knees to stay slightly more bent, which can be an unsafe way to walk. But if you have really tight or spastic hamstrings, your knees will stay bent like you're in a crouched position. And if you have tight calf muscles, so Yvonne said she also feels a stretch in her calf, the back part of your lower leg. When you have tightness there, that can actually increase foot drop. So foot drop is due to weakness on the front of your ankle, which is why we like that first exercise so much, but it's also due to tightness on the back. So by stretching out that calf muscle, it again is a great exercise to help reduce foot drop. So stretching is really great. One other thing that I'll add too, newer research about spasticity says that stretching for prolonged amounts of time is best. It used to be thought that stretching for about 20 to 30 seconds, 2 to 4 times each side was best, but specifically for spasticity, you can hold your stretches for 2 minutes, 3 minutes, 4 minutes, and that has been found to be effective to reduce the spasticity.
So that's actually, a lot of people refer to it as yin yoga or restorative yoga, or we're really just holding the poses for longer. And that's where you get to make the practice your own. And as you said, Dr. Gretchen, you might do both sides a few times. I tell people to do this pose when they wake up, before that you can keep one of these stretchers by your bed and do it before you even get out of bed or before your sleep if you know that you often wake up with spasms throughout your day. I don't know if you can do enough of this if you got a lot of rigidity or spasticity. And you certainly can hold this pose. And as you hold it over time, you feel the stretch move in different places. Mm-hmm. Would you agree with that, Yvonne?
Yes, I do agree with that. It makes it a little bit more limber, where I can move a little bit better than I did at the beginning. I can go up the stairs a little bit better and easier after I do these type of stretches.
One thing I want to mention as well, I know we're answering questions at the end, but I saw it, I want to comment on it. So someone said, I feel it in my quads, nothing in my hamstrings or calves. Keep in mind that when you are stretching a leg or a muscle group, that leg that you're stretching should ideally, in my opinion, be dead weight. You are not holding it up at all. And oftentimes, if you're feeling it somewhere else, you are actively trying to hold that leg up yourself. So in this exercise, if Yvonne's leg is not fully relaxed, it's her quad muscles that would be trying to keep her leg there. So if you are feeling it in a different muscle group, remind yourself, relax, let it go, just dead weight. And then it should transition to a stretch in the more appropriate area.
Yes, and that's why this prop right here, and breathe, Yvonne said, and breathe. So yes. That also is, how yoga is a little bit different with our focus on the breath. So if we're gonna stay here, we focus on breathing as we do this, and then we become more aware of the sensation in the body. And that's also another benefit of it. And then you become a little bit more familiar with, how is the stretch impacting me? Should I come out of it? Can I go a little bit further in to it? And going further in might mean leaning slightly forward, but we don't want to do that until the leg is ready for that and the spine is ready for that. All right, we will slowly lower that leg down and move on. I think this is your favorite pose now, Yvonne.
Oh, I will be practicing it tonight.
Okay, number 4. No, you told me the other day number 4 is your favorite pose.
Yes, it is. Yes, it is.
All right, so let's show number 4.
I know there's a lot of different ways that you could do the number 4, but my favorite is to take the leg over the thigh. And I know from the classes you can do them on your ankle, or you can move it up a little bit, or you can use a block, anything that's comfortable for you. But for me, I like to go all the way. And I will put it all the way up on my thigh and just sit there as long as possible. And whatever, I can sit there for a long period of time and work my ankle and toes, give a foot massage, as we all know about, and keep going with it.
We're really into foot massages, by the way. That's part of the yoga and the myofascial release. So yes, Yvonne, see, I told you Yvonne can be the teacher. You guys don't need me. But once they've been with me for a while, they know the shtick. But you might put your foot on a block, like so. Some people like to rest their knee on an ottoman or another chair next to them. And some people put it over. And we like to keep the shin and the knee and the toes all aligned to keep the knee really safe. You can gently press your hand into your thigh, and that might bring a little bit more sensation in. You might, as Yvonne said, keep your hand on your foot, or maybe even make a little yoga fist. And when you start to feel sensation, then you know to stop. If you're not feeling it yet, you can go ahead and lean forward a little more, lengthening the spine forward. And some people are super loose in their hips and others are super tight. So you get to decide how long you stay in it and how far you move your spine forward and downward. Anything you would like to add? Dr. Gretchen, what are the benefits of number 4, gentleman's pose?
Yeah, number 4, and I'm just going to throw this out there. You guys are amazing demonstrators. I am one of those people with tight hips. So I do not look like you guys when I do that stretch. But again, this is a big one where it's really easy. If you're like me and you have tight hips, my leg does not just fall down like that. And I know some of you guys on here can probably relate to that. Therefore, I need to hold on with my hands. If I don't hold on to my ankle with my hands, I actually am using that leg instead of relaxing it. So I'd feel the stretch instead in my, or sorry, not stretch. I'd feel tightness in my hamstrings instead of a stretch where I should on the outside of my hip and my thigh. So if you are tighter, still remember that leg should be dead weight. Use your hands to anchor it on there. With that said, regardless, this is an amazing stretch for hip mobility, which again, our hips are a central part of our body. Our hips are related to our legs and our back and our abdominals. Everything is all in that one area. So the more flexibility, mobility, and strength we have there, the easier movement will be. So I agree with everyone in the chat and with Yvonne. This is a really, really great stretch.
Of course, Yvonne knows.
Yes, I do it even when I'm sitting at the table eating dinner or lunch, I will fold my legs this way versus this way, because I'm getting a stretch while I'm sitting at the table, I'm sitting in my chair looking at television, or whatever the case may be.
Let's show warrior pose.
Okay.
I'm not sure if that's your favorite pose or not, but we're going to show it. So you decide which version is right for you, Yvonne. And I'm going to show it this way. We're going to have our right knee out to the side, and you might adjust yourself on the chair so you're comfortable and you feel supported by it. And both sitting bones are on the chair, so our hips are on the chair. Now, the right knee is bent and the knee is over the heel and the kneecap is pointing towards the middle toes. Very often, sometimes the knee moves inward or maybe outward, so we can use our hand to hold it and maybe even to give it a little bit of pressure in. You can press the back of your hand into your inner thigh and your thigh into your hand. Now, Yvonne, you can see, is holding both legs. And she's decided to keep this knee forward. And you want to do that to protect your knee. If you have any kind of thing going on in your knee, that may be the best option for you. We do not want to torque the knees. So safety is the top priority. We might lift one or both hands into a T. We're going to take it wide. Now relax your shoulders. You're going to gaze like a peaceful warrior over your front arm. There you go. And we might relax the shoulders by turning the palms upward. And so you can see Yvonne's stacking her shoulders over her hips. And she might, to bring some more strength into this, she might push down through her feet and then lift up and out of her waist. Or you can come out of it, that's a while to be in there.
Okay. That was great.
There are different variations on Warrior 2. Those we're showing today. All right, Dr. Gretchen, you want to say anything about Warrior 2? I'll show it standing just so you can see. And very often we have a chair in front of us in class for those of us who want to practice standing. So they might use the chair like this. Sometimes it's off to the side. I love practicing against the wall as well for balance. We might have 2 chairs, and the stance is going to depend also on balance. We want a wide stance for Warrior, but as wide as your body feels safe. And so this might be what it looks like in the chair. We might have one arm back. We might play with alternating arms. What would you like to add to that, Dr. Gretchen?
Yeah, so first of all, this is the first pose that we've done today that gives a really good stretch to our inner thigh muscles, just simply by having your legs wider than what is normal for you. You're getting a stretch there. And that's really important because when those inner thigh muscles are tight, again, your knees will collapse inward. We've talked about a few things today where your knees will collapse in. Tight inner thigh muscles is one of those. So this pose, yeah, is just so good for stretching those inner thigh muscles out. And secondly, this requires endurance in your core, in your posture, in your thighs, your calves. So if you feel like you have a good amount of strength, but you can't last very long, like you can only utilize that strength for a little bit of time, poses like this are great to increase your muscular endurance so you can use that strength over a longer period of time.
Thank you. I think we have time for maybe one more pose. Oh my goodness,
Where did the time go?
let's do thigh stretch, because you were mentioning that one the other day.
Yeah.
It's Crescent Pose. And so Yvonne's going to show it. She first sits to the side. And then she's going to take her outside leg back. Now we have different props we might use to help Yvonne. We might put a blanket under her foot. Now she actually likes her toes down like this. It looks like you're comfortable like that, are you?
Sometimes I put my ankle flat.
You like it like that?
Mm-hmm.
Okay, so yes, you can have your foot more active, or you can have a stretch going across the front of the ankle in this pose. So we call this crescent, and then she may or may not lift her one or both arms up. And so the focus here is feeling a stretch through the leg that's back. She might feel it along the whole side of her body. And we ask her to pull her ribs back and then lift all through the spine. And where do you feel this stretch, Yvonne?
I feel it all over. In my spine, in my legs, in my thighs, in my arms, all over.
You can stay as long as you want, Yvonne. I know you're a strong, determined person, so you decide when you want to come out of that. There is another option that I've seen, and some people like it and some people don't. So I'm going to show it. This will get into the thigh, and sometimes this pose causes some lower back pain for people, and so it may not be the best version of a thigh stretch. I just want to put that out there until we are able to pull some core strength into this. Now she's going forward. She's showing you all her different variations on this. But another variation to stretch the thigh is to bring one leg back and then slowly lower the knee down. I've seen some people who like this and some people who don't like this so much because there's some cramping that can go on in the foot if it's not warmed up properly. This is the one we tend to do. We also tend to do a thigh stretch either on our belly. I've seen Dr. Gretchen, you sometimes demo this in bed, laying on your back and letting the foot hang off the bed. In yoga, sometimes we lie on our side or on our belly to get a good thigh stretch. What would you like to add, Dr. Gretchen?
Yes, I think finding a variation of this stretch that works for you is extremely important, because when your hip flexors are tight, and as Yvonne mentioned, you might feel this one many different areas. So you're going to feel it where your body is tightest. But for a lot of people, it's in your hip flexors, the front of your hips. And when you have tightness there, you tend to be in this flexed position. So you might walk like this, or you might stand like this, and it's because of tightness here. So by stretching out that muscle group, you can improve your standing posture. You can walk with better posture. And it's rare to get that stretch in any other way. So you can do it in both of those ways that Yvonne and Mindy showed. I also like doing that seated or lying on my bed, as Mindy mentioned, with your leg hanging off. But yeah, stretching your hip flexors. We use our hip flexors a lot throughout the day. I personally feel that the muscle group we use the most are the hip flexors. Anytime you walk or lift a leg or scoot forward, get into and out of bed, into and out of a car, you need to use your hip flexors. So that means you also need to stretch them. So that's why I like this exercise, this pose.
This pose can be done standing, by the way. And so some people like to have a chair in front of them and take a leg back. And so sometimes in our classes, we will bring the leg back, and you can play with balance in here too. And almost all of the standing poses in yoga bring strength. You know, they wake you up. They're more activating. And so it is a possibility to play with this pose in standing as well.
Right.
All right. See, we're open to possibilities in yoga, and we come up with different variations. All right, how's our timing? I'm being given the warning. What does that warning say? 1 minute. All right, let's do a forward fold together. All right, we're gonna take our arms up overhead, and the cane's gonna tip over, and then we're gonna exhale, arms out to the side, and let them flow down towards the earth. And let your body hang. So we're not forcing anything here. This is one type of forward fold. And we're just letting the body relax, maybe let your head sway right and left. You want to tack your hips down so you don't fall forward. And you might even take your hands to your hips. Another version is to keep your shoulder blades on your back, and maybe you don't go down quite as far. All right, let's push down through our feet and rise up, arms up overhead, and hands at the heart. Okay, question and answer time. Make sure you stay on if you want a chance to win the prizes that were mentioned at the beginning. Dr. Gretchen's giving a month of her programs out for 2 winners, and we have a book and adaptive yoga cards and a leg lifter for whoever are the winners of the prizes today. So let's move on to question and answers. Are you, Dr. Gretchen, you might be able to see them in the chat.
I can. Let's see here. I can scroll back up. Okay, so one question we have is, are your glutes engaged during mountain pose?
Would you like to answer that?
Sure. I would say yes, absolutely yes, if you're standing. And yes, when you're seated, if you're focusing on it. So much, I don't know if you find this, Mindy, but so much of exercising and holding poses is just thinking mentally about what muscle groups you want to be activating. It's very likely that if you're not thinking about activating your glutes while you're sitting, you're not activating them. But if you think, okay, and tighten my glutes, they will tighten. So yes, when you're standing, because if you're not tightening them, you'd tip over in some way. But when you're sitting, yes, if you focus on it.
So I would add a little bit about, so sometimes we put the block in, you know, for the stability in mountain pose as well. And we always have this discussion going on. It's been a thing going on in the yoga world. We know in PT, a lot of times people are told when they do the pelvic tilts or to squeeze and tone their hips. And we tend to say more tone without the squeezing, because we find that people just get really rigid, and then the breath is labored, and there may even be some back pain that comes as a result of it. So we do more of a toning of the glute muscles. So this would be, and we tend to see this happen a lot. That's why we focus a lot on posture, is that people tend to hang their hips forward. So we do a lot of work to take the hips back, then angle the sit bones down and tone. But if you're new to yoga, this is all way too much information. But do you want to add anything to that, Dr. Gretchen? This is one of those things where I would love to sit and have a talk with you about.
Yeah.
Do we squeeze or don't we?
I know. I feel like for each of these poses, you and I could probably talk for about an hour on each individual one. Okay, so can these be done sitting on my heels on the floor? I think that was in regards to the crescent pose. Do you ever do it in that position, sitting on your heels on the floor?
Do you mean like this?
Maybe.
Maybe.
That's a good variation.
So I'm sitting on, I think they're thinking of another pose, Dr. Gretchen. They're sitting,
Okay.
I think they might be talking about, it's called hero's pose. And they might be like this, or they might be like this. And there are variations to that. I'm not sure, but that may be, and this is where very often, this is a wonderful thigh stretch for people. And we use all kinds of props for this pose, where we put blankets or pillows, it props in between the calves and the thighs so that the knees don't pinch. This pose is not for everybody, but it does stretch the top of the ankles, and it very often is a stretch in the thigh, the quads.
Yeah, I like that one. Okay, so the next question is, so if I go into a stretch and have a spasm during these poses, do I just breathe through it and continue? What would you say to that?
Okay, so when I first started teaching yoga, I wanted to push through it and push it, and darn it, this leg is gonna stop spasming and I'm gonna help them. And it's not gonna spasm anymore because we're gonna stretch it out. And guess what I learned? That's a big no-no.
That's not right.
That's not right. If the leg spasms, I would come out of it, give it a little break, and maybe even massage the back of the thigh with your hands and take a breath break and then go back into it again. The body this is one of the messages that we get from yoga, is the body is always sending us, hey, listen to me. The spasm is communicating. And so we use that communication to decide what to do next. So in that case, I would take a pause, massage it, and then go back in and maybe not go as far.
Yep, I 100% agree with that. Spasms are not comfortable. And I don't think anything that we do in yoga or physical therapy, exercise in general, nothing needs to be uncomfortable. It's like Mindy said earlier, it's not no pain, no gain. So I agree. I personally would not breathe through it. I would come out of it, shake, shimmy, get that spasm to go away, breathe out of it, and then go back into it, but just maybe not as far. Good.
I had one of my teachers, he has a lot of spasticity from a spinal cord injury. And before he even gets out of bed, he shakes like crazy just to get some of that spasticity out of there.
Yeah, I took a continuing education course once, and shaking was one of a huge time. We talked for hours about the importance of just shaking and, waking your muscles up, but also getting them to relax. Yeah, so shaking is a really good thing to do. Okay, and we've got a bunch of questions. So if I need to stop at any point, Laureen or Mindy, just let me know. And then we can announce our winners. One question I see is, if I cannot utilize one of my legs, how do I stand up without using my hands? Ooh, I'll start with this one, if I'm understanding the question correctly. So much of standing up is positioning. So whether you can use one leg or both legs, or even if both legs are really weak, making sure that your feet are firmly planted on the ground, wider than your shoulders, and bend your knees so that you're in the right position. And then it's all about getting your shoulders far enough forward so that you can push down through your legs. So I want to demonstrate this. I'm going to scoot back. Never do this on a wheeled chair. I just happen to be sitting in one.
No, don't do that.
No,
I'm not actually going to stand up. So
No.
the first thing that you need to do is scoot forward. It's going to be impossible to stand up if you're all the way back in your chair. So to stand up, you want to scoot forward, make sure your legs are wide enough, and then bend your knees a little bit. And that's just positioning. We haven't even attempted to stand up yet. So make sure your legs are in that position. And I'm not going to do this now because I am in a wheeled chair, but then you would try to get your shoulders as far forward as you can before attempting to push through your legs. So that's what I would suggest, is remember the importance of positioning and alignment. But do you have anything to add to that, Mindy?
I think you did a good job with that one. We use that root to rise a lot.
Oh, and one other thing, go ahead.
If the legs are locked, that's also another thing that can, add to not feeling strength or the muscles don't activate.
Yeah. And another thing too, Mindy had mentioned earlier to put a block between your knees. So that would be an option. I actually like to put a resistance band around your knees.
Yeah. Didn't even show that one. Yes, we sometimes do that where you place a strap because that helps a different area, right?
Yes. Completely different muscle group.
Yeah, I'm just showing what it would look like, but something like this, where we put the strap or the resistance band, as you said, and then you can actually push out into it instead of using the block. So that gets into muscles, correct, Dr. Gretchen?
Absolutely. And by pushing out against the strap, you are activating the outside parts of your legs, the outside hip, the outside thigh, and that can be really helpful to get you to stand up.
Yeah, you can even use your hands to play with that a bit. If you take your hands on the outsides of your thighs and then push the outside of your thighs into your hands, you can feel it.
Yes, you can.
All right, let's see here. And Adam mentioned Yoga Moves has beginner classes a couple days a week that you can join. So that's awesome. My ankle flips and I lose balance while walking. How can I fix it? Balance while walking is actually very intricate. The way this question is a little confusing because I don't know if it's the ankle that's causing you to lose balance or the balance in general. Because if it's the ankle, you actually need to focus on strength training. But if it's the balance, then you need to focus on balance training. And realistically, you probably do both at the same time. But for balance, what I want to remind people of is balancing in the exact position that you lose your balance is what you should be doing as an exercise, but make it easier so that you're not falling all over the place. You want to be successful at it. For example, in order to walk forward, you need to be able to balance in a staggered stance. So if that's tricky for you, separate your legs even wider and see, can you balance there? If that's too easy, come a little bit closer or a little bit closer, but practicing in that staggered stance is really important. Also, 40% of our gait, 40% of taking one single step forward, you're standing on one leg. Even if you're using a mobility aid, you're still standing on one leg. So you need to have at least a little bit of single leg balance. So that can be really, really challenging. There's ways to make it easier, but practice those specific positions. What do you think, Mindy?
You have whole sessions on walking and really dissecting it and helping people understand. So that's awesome. I would think even like the Crescent Pose helps because we can widen our legs and play with where the weight is in the front foot versus the back foot. I'm getting the signal here, Dr. Gretchen, that over time, we want to announce our winners. So you're going to want to stay on. And I want to thank all of you for being here and participating with us. And I know there's a bunch of questions. Are there a bunch of questions, Dr. Gretchen, that are still not?
That's okay, though. Maybe we can have a chat some other time and send it out to everyone.
That's always the hardest part, the ending. I do want to thank our sponsor. Once again, this event is sponsored by More to MS, a Janssen Pharmaceutical Incorporated initiative to support the MS community. And my dog is trying to run for it. It's okay at this point. Yeah, it's all right. It's all right. And so we're going to announce our winners. And you guys ready to announce the winners?
Yes.
We want to express gratitude. While they're getting the winners ready, I want to express gratitude for you being here. If you want to learn more about yoga, please join Yoga Moves MS. As Adam mentioned, we have classes throughout the week. Foundations, these classes are structured for questions and answers where you can come in and get answers to your questions. We have all different kind of classes for balance and core and restorative and mixed, or some is standing and some is in the chair. So please, there should be something for everyone. I want to thank Dr. Gretchen. Can you put her slide on so they know where to get to her? I know most of you know Dr. Gretchen, but here you can find her on her website, on YouTube, on Facebook, and she's got her email address on the screen as well. I just love doing these sessions with you, Dr. Gretchen. I feel like yoga therapy is very much a sister to physical therapy. We learn so much from each other, and it's like we're sisters. So I want to thank Yvonne. Thank you for being so ready and willing and sharing. You can see her light glows. She glows. She's very joyful.
Thank you, Mindy. And
Thank you so much. There's people behind the scene that have been helping out as well. Lorene, our tech specialist, and Kathy McRae, making sure everything is going just right. Thank you so much, and we hope you have a wonderful day. At the end of a yoga practice, we say namaste, where we acknowledge that everybody has light within them. And so when we say namaste, it's not a religion, by the way. Some people think yoga is a religion, but we are acknowledging your light, and our light is bowing to your light. So namaste.
Namaste, everybody.
Thank you so much, Dr. Gretchen. Thank you so much, Yvonne. Thank you so much to More to MS.